So last week I presented the case of the gentleman with the ameloblastoma, and a lot of you left some interesting suggestions in the comments. This is how we solved this particular patient's problem. So first things first, we knew we needed to get some implants in there, and therefore you can see that implants were placed on this panoramic radiograph. We used short implants shown to be very successful in the literature, and you can see that this is very dense cortical bone, so placing those implants itself was quite challenging because it was extremely dense. Now, the important thing we did before this surgery, and you can see on the panoramic as well, is to place these mini plates, which were placed by my oral surgeon before I placed the implants. This is so that in case there was going to be a fracture of this bone, then the mini plates would have held it together. Why would I suspect a fracture? Simply because the bone is so dense, and the concern is when we're placing these implants, we may introduce a crack line. The next concern is soft tissue height. Because of the huge amount of loss of the mandible, there is a large amount of soft tissue. Now, how do we make sure that our tiny little implants over there are still peeking through? So we had to make some kind of customized abutment using the mount, and you can see that in these pictures. Finally, it became painfully obvious that the only way forward on this case would be to use very tall multi-unit abutments, and that's exactly what we did. And here you can see on those multi-unit abutments, we have done a bar, and on that bar, we have waxed in or casted equator attachments. And now we have a simple overdenture unilateral on those equator attachments, providing form, function, and aesthetics back to this patient. The only thing that we need to do for him from time to time is to change the attachments, because the retention would drop, and that happens about every year, year and a half. But otherwise, he's doing a great job maintaining it. I see him every 6 months or so to make sure that he's doing a good job and he's able to keep things clean. It's also very important that he keeps the bar itself clean inside the mouth, not just the overdenture that we made for him. So all in all, I would say that this is a successful treatment and a happy patient. I hope I've confused you enough. If you have any further questions about this case, please ask away in the comments below. Till the next time we meet, this is the Dental Review Guy signing off with a smile.